Welcome to episode 7 of the series PEP Talks on Pain in Children. Now that we know how to assess pain, let's take a look at what can be done to address pain in children. Good day from me, Annemarie Overholzer. Today we're going to discuss pain management for children during medical treatment and procedures, and we're first going to focus on children older than 18 months. In the next episode, we will discuss pain management in babies. It is important to note that in 2010, the Declaration of Montreal was issued by the International Association for the Study of Pain and signed by attendees of the first International Pain Summit of IASP in September 2010. The Declaration of Montreal clearly states that access to pain management is a fundamental human right. First of all, I would like to draw your attention to a position paper from the World Health Organization on reducing pain during vaccinations, and they give a number of measures on how to reduce pain in infants and children. Unfortunately, we don't always see these measures in practice, even though this was already published in 2015. So some of these measures are, for instance, that parents or caregivers should be present and hold the child throughout the vaccination, that children older than 3 years should be seated in an upright position, that babies should be breastfed during the procedure, and that children should be distracted. And we will now look at those measures applicable to children older than 18 months, and in the next episode we will discuss the measures applicable to babies. Also note that during the presentation, whether I refer to a parent or a caregiver, it implies the person taking care of the child when at home. So let's start at the very beginning. First of all, we should prepare all children for the experience. The age at which children will be able to grasp what you're telling them will depend on the individual child. So we can start to prepare all children from the age of 18 months. Obviously adapting your language, the way you talk to the child, and the pictures and props that you're using according to the age and attention span of the child. Now some people, including myself a couple of years ago, think that you will traumatize a child twice. First, when you tell the child about a procedure, and secondly, when you actually perform the procedure. Well, luckily I discovered the truth, and that is that when you prepare a child for a procedure, you can address any misconceptions that the child may have. You can reduce their fear, and you will increase their understanding of what is happening to them. Let me give you an example. A few years ago, we had a little boy who came to the hospital for a minor operation. The problem was, this was his second experience of a hospital. The first was when his father died in the same hospital a few months earlier. He really thought he was going to die that day. Maybe he overheard a conversation of adults blaming the hospital for the father's death. Who knows? Bottom line is, children often have misconceptions because of their limited life experiences. So when you prepare a child, you can address these misconceptions. You can help the child to cope better, and it will be less traumatic for the child and also less painful. And if the child knows what is expected of him or her, you will also get a child who can cooperate with the procedure. But wait a minute, why do I say it will be less painful? Remember this slide from a previous episode? In a stressful situation, the brain needs to get as much information as possible about the environment causing the stress to determine the severity of the stressor. It increases impulses going to the brain, and this is obtained through the secretion of certain neurotransmitters. For instance, substance P will increase pain impulses to the brain. It also increases brain activity in the areas processing pain. All of this in order to be able to make an informed decision on how to protect the body. Some non-painful impulses can therefore be registered as pain. So a child who is prepared and knows what is going to happen will be more relaxed and therefore experience less pain. So how do we prepare children for a procedure? Let's take a look. Preparing children for a healthcare experience helps them to understand what is going to happen so that they can cope better with the situation. But how do you do that? It is important to remember that we should always prepare a child for everything that is going to happen, whether it is taking a blood pressure reading, temperature, or something more painful such as an injection or a drip. So where do we start? First of all, clarify any misconceptions that the child may have. It actually happened that a child thought that she was going to die from an injection, as that was what happened when a dog had been put down by the vet a few weeks earlier. Or children can have other fears that seem to be irrational to us as adults, but that can result in a very traumatic healthcare experience. So it is so important to talk to the child and ask what she thinks is going to happen. Secondly, explain the reason for the procedure or hospitalization and make sure that you use a language that the child can understand. For instance, you can say that the germs are building houses in the lungs and that your child needs some extra strong medication to give the good soldiers in the body super weapons to fight against the germs. Next, explain the sequence of events. For instance, you can say that the child will go on a bed with wheels to the theatre where they will see very big and bright lights. There's also a dream machine that will give them nice dreams to dream. When they're done dreaming, they will go back to the bed in the ward where they will get something to eat, and afterwards they can go home to play with their friends. Always prepare children in relation to their senses. Explain what the child is going to see, and if possible, get photos of the actual hospital or theatre so that the child can see what it really looks like. What is the child going to feel? Maybe the stethoscope will be cold. You can also let the child play with some of the equipment if it is safe for the child to do so. You won't always be able to let the child smell something before the time, but you can, for instance, explain that the anesthesia mask is going to smell like something the child has never smelled before. Ask the child to tell you afterwards how he or she experienced the smell. The same goes for taste. Don't tell the child that the medication will taste awful. Rather give the child the chance to give his or her own interpretation of the taste. If there's a specific sound that the child will experience, such as the sound of the MRI scanner, try to find a recording of the sound on the internet so that you can play it to the child before the time. Also explain to the child what is expected of him or her. You can say that the child has a very important job, and that is to keep his or her arm very still during an injection. You can further explain that the child can play a card game, handheld game, or read a book. Whatever it is, it's important that you give the child some choices. It is also very important to check the words that you use throughout the preparation. Instead of using the word cut, you can say the doctor is going to make a small opening. Don't refer to the needle of a drip, but explain to the child that it is only going to be a small soft tube that's going to stay in his or her arm. The word knife might also create scary images for the child, so rather say that the doctor is going to take out her tonsils with a spoon. And lastly, explain the long-term outcome to the child. For instance, you can say to the child that he will have to wear a cast and walk with crutches, but he can still play with his friends. He might not be able to kick a soccer ball around, as he might have to play indoors for a while, but then you can assist the child to think of something interesting to play indoors if needed. It is important that children should not witness procedures on other children. Preferably, they should not even be able to hear other children screaming during procedures. So it will be best to do all procedures in a treatment room that is as far away as possible from the other rooms. Okay, so now you have a child who is fully prepared and knows what is going to happen. Let's see what's happening inside the treatment room. Always keep a child in an upright position as far as possible. If children have to lie down, you take away their control and make them feel so much more vulnerable. Here's a few examples of how to keep children upright during procedure. As you can see, the child is sitting upright on a staff member's lap, and the caregiver is doing distraction away from the procedure area so that the child doesn't have to watch. The child is being held in a comforting position and would rather feel comforted than restrained. And she can even kick with her legs, and it will not impact the person putting up the drip. But maybe a child wants to see what is happening. It's important to listen to children and to take their views into account. So if a child really wants to watch and will be okay with watching, he or she can do that. In this picture, the child is sitting on the caregiver's lap, watching the procedure. Maybe the caregiver can use a book for distraction and to partially block the child's view, but still allow the child to peek around the book if he wants to. And this is how you can hold a smaller child if you have to put up a drip in the foot. The caregiver is holding the child against her in a comforting position and the staff member is doing the distraction. So it's clear that caregivers can play a valuable role in the treatment room. However, many people believe that when parents are with the child in the treatment room, the child will blame the parent for everything that's happening to him or her. But that is not what research is telling us. In fact, parents and caregivers are the child's most important source of support and comfort, and they should be included in all aspects of the child's care. However, they should also receive adequate support to be able to fulfill their role. Okay, so what is the job of a parent? Parents should be careful not to use excessive reassurance or apology. You will often find that the parent would say to the child, "Oh, I'm so sorry, baby, I'm so sorry, I'm so sorry," or stating repeatedly that everything will be okay. You know what? This only serves to increase anxiety in the child. So you see, when the parent is doing distraction with the child, which is, so by the way, his or her main job during the procedure, the parent can focus on the task and talk about that in a calm way, and they won't feel the need to repeat themselves in reassuring the child. They can even use humor. Humor can be very relaxing to the parent and the child. Remember to encourage good behavior, even if it's just something very small. For instance, tell the child that she's doing a great job by keeping her arm still, or that you think it's great that he's listening to the healthcare professional. And if the child is not coping at all, tries to manipulate the staff or postponing the procedure, never criticize. Just ignore what the child is doing. So how does distraction work? The basic principle is that what you focus on takes over your brain, and what you ignore gets smaller. So if you focus on the procedure, that is what is going to take over your brain. And if you expect it to be painful, it will increase anxiety and increase pain. But if you focus on a distraction, your brain will relax and it can even forget to register the pain as a threat and therefore decrease the experience of pain. And research is backing this. These researchers found that the activity in the area processing the brain was significantly decreased when the subjects were performing a distraction task. And they measured the activity in the brain by measuring the cerebral blood flow of the participants. The altered activity was also accompanied with lower ratings of pain during the cognitive task. In another study, children demonstrated significantly less fear and distress during distraction. And all the parents of these children said that the needle stick was just so much better because of the distractor. So what is important to remember during distraction? Well, first of all, is a dual awareness, meaning that you don't distract the child on the one hand and sneak up on him from the other side. Children must always be informed on how the procedure is progressing. It must be interesting to the child and be able to get and keep the attention of the child. It must preferably involve active participation from the child, such as an interactive computer game or getting the child to sing along. Make sure that it corresponds with the developmental level of the child and that it's easy enough for the child. And remember that stress may cause regression and that children may not be able to do the same difficulty level than they would normally be able to. So it's a good idea not to use an activity with right or wrong answers, as this might increase stress for the child and also elicit criticism from the parents who may not realize the effects that stress has on their child. Aside from distraction, it's also important to get the child to relax. Remember, I said that the relaxed brain will tone down the pain message, but it will also combat pain in the following ways. It helps muscles to relax and decrease muscle spasms. It changes serotonin metabolism. Remember, serotonin is a neurotransmitter inhibiting pain and can also contribute to a calm mood. It increases endorphins, the body's own morphine. It increases pain tolerance and a decreased serum lactic acid levels, causing muscle pain and decreasing pain this way as well. However, relaxation is a learned skill, and children will find it difficult to relax just by focusing on the relaxation in itself. It is therefore important to use it in combination with other relaxing activities, such as deep breathing. You know what, blowing bubbles is a great activity as it requires deep breathing and also serves as a distraction. Gentle massage with no pressure, just gentle stroking. Listening to relaxing music. Relaxation exercises such as tensing and relaxing one muscle group at a time. And lastly, guided imagery. And that's where you ask a child to imagine that he's playing on the beach and involve his senses. Ask him what he's smelling, like suntan lotion, or what does the sand feel like beneath his feet, or what can they hear, maybe the waves crashing. Remember that the scene must be familiar to the child and something the child would actually like. So give the child the choice. Something else that has been used successfully during a short procedure, such as an injection, is the cough trick. Coughing once before and once during the shot can actually reduce pain during injections. And there's also research study done on this. Authors find that it can be a very effective strategy for the reduction of pain for some children during routine immunizations. Procedures does not have to be painful, and it's important to ensure adequate pain control during procedures. Numbing cream is an option and should be readily available. However, it does take a while to work and not always very practical, especially if you have to use more than one site when looking for a vein to put up a drip. Tactile stimulation has been used very successfully and work according to the gate theory of pain as discussed in the previous episode. Tactile implies a sense of touch, and tactile stimulation works by competing for the same nerves used to send the pain message to the brain. Buzzy is a small vibrating device doing just that, and you can find out more on their website here on the screen. If you don't have a vibrating device, you can try something with soft spikes, such as the toy ball, or even a soft hairbrush, and stroke against the skin just above the procedure area. However, it will not be as effective as a vibrating device. Just a quick note on going to the dentist. If children are traumatized in one healthcare area, it will be difficult for them to cope with any healthcare experience in future. Ensuring that a dentist appointment is a positive experience will not only ensure a child that is compliant with going to the dentist, but will also reduce trauma for all future healthcare experiences. Children can therefore be encouraged to use cool sunglasses to block out the bright lights and earphones to block out the sound of the equipment. Distraction can be used as described just now in this episode, and Buzzy has also been used very successfully, applied on the outside of the cheek if a dental procedure is painful. After any procedure, medical play can help the child to play out what happened during the procedure and will also familiarize the child with medical equipment to make it less scary in future. And lastly, saying to the child that they were very brave and that you are proud of them will go a long way in creating a positive memory of the procedure in the child's mind and make future procedures less scary for them. You can give children a printed bravery certificate or even collect old sports medals and give that to the child after a procedure. So that brings us to the end of this episode. Next time we will discuss ways of managing pain in babies. Till then, goodbye.